Hey, welcome. So we are here with Dr. Zhang, who is a pediatrics pharmacist, and she is going to talk to us about how to keep our kids safe when they come into the hospital. So really, that is the first question. When parents are coming in with their kids through the emergency room, even to an urgent care, sometimes we are so frazzled because of what is going on initially that we may forget things like allergies or things we might have eaten or ingested that cause drug interactions. What are tips that you can give parents to alleviate that?
I would tell parents to be very good historians, and if they could write down what exactly happened during the day, what medications they gave when they had given them. So say if it's Tylenol or if it's albuterol to treat asthma, we need to know exactly the dose that was given. And also in regards to allergies, it should be the patient's true allergy, as in there was a reaction that the patient had, and not just because the parents or an aunt or a sister has the same allergy. It should have been observed that the patient does truly have the allergy. And then if the patient is on any medications at home that the physicians have prescribed, we want to know the exact doses, and if it's a liquid and it is in mLs or cc's that you remember, please give the actual dose, because the concentrations can be different from hospital to hospital, and we don't want to overdose if it's something that is more concentrated, that the version that we give.
Oh, that's a really good point. So would you recommend maybe like having a little baggie, a grab bag of medications, and take it out the door? That way you can actually see what's on the bottle.
Yeah, of course. So bring all of the medications as they are. Don't take them out of the bottles. Don't empty them into a syringe or other pill boxes. We want to see exactly what was dispensed from a pharmacy. So in that case, it's hospital policy to only use things that are labeled. So if it's labeled, then we will be able to.
Well, thank you for that. Super helpful. I know definitely the next time I have to take my kiddos into the emergency room, I'm gonna have everything ready, gonna write down a list. I guess really similarly too is, it's midsummer. A lot of us are traveling. We're taking the kids with us. We may be going really far internationally. And so I'm always super stressed when I'm thinking about what do I need to take in terms of medications. What are some of your favorites?
So for your medications, if it's something that you use normally and you prefer them, don't forget to take them with you, because you may not be able to find them in the country that you are in, and it may be in a different language, the boxes that you may find as well. So to prevent the headache, just bring your own. So I have some of my favorites. We can't live without Tylenol. And so this is the liquid Tylenol for smaller patients. And 12 pounds is kind of in my head as the cutoff. If you're 12 pounds and below, you should probably bring the liquids. And there's only one concentration on the market.
And TSA approves this?
Yes, up to 90 mLs, but if you do have liquids that are more than 90 mLs, show them the proper bottles, and they will be okay, because there's medications and an exception will be made.
Oh, that's good to know.
And then if you're 12 pounds and above, you could actually save on the liquids and potential spills in your luggage by bringing chewables. And so there are two different sizes of chewables for Tylenol. There is the 80 milligrams, and I have here the 160. So if it's 80 milligrams and your child is more than 12 pounds, they can use that dose. You can also cut these 160s in half. And to use a 160, you should probably be about more than 22 pounds to use the full size. And then another item I usually bring is antibiotic cream, just in case your kids fall and there's scrapes and scratches.
Oh, can't live without that.
So my other favorite medication is melatonin, and it will help kids sleep when you're traveling eastbound. That's when your body is trying to sleep at a time where it's not ready to. And I would pick up the 1 milligram tablets or chewables. So for kids greater than 3 years old, you can start using the 1 milligram. Up to 6 years old, you can do, over 6, you can do 2 milligrams. And then, 6 to 12, you can do 2 to 3 milligrams of melatonin. This is Zyrtec. It's one of the newer generation antihistamines that doesn't cause drowsiness, and you don't want that on your trip. I have 2 different formulations. The liquid is for younger kids, but your child has to be at least 2 to use the liquid. And 2 to 6, you can use 2.5 mLs. Or you can also take the tablets and cut it in half, and that would be the same as the 2.5 mLs of the liquid. So whichever one you want. It's great for allergies. It's great for runny noses. So I always have these with us.
Well, thanks so much, and bringing these. I think next time I'm just going to have a list. I'm going to text you. You're going to send me the list. I'm going to get everything in a nice little bag to go.
Great. Sounds
Well, I hope this has been very informative. I know that I've definitely learned something, and thank you again so much, Dr. Jane, for coming and giving us these really, really helpful tips. Thank you.
It's my pleasure.